Overall, Indiana right now is really in the middle of the pack compared when you look nationally and compared to our neighboring states. So that we know our kids are actually surviving here in Indiana, but unfortunately they're not thriving. Right now we are ranked 28th overall for child well-being, which puts us a little behind Illinois and Ohio, but higher than Michigan and Kentucky. For the four areas that we really look at to define child well-being are education, where we're ranked 14th, economics, where we're 19th. This is the area where we've had the biggest improvement, where Indiana saw the biggest improvement, and we're actually strongest amongst our neighbors in that category. Family and community, we're ranked 31st, pretty consistent with those around us. And then we're ranked in the category of health, we're ranked 35th, which unfortunately puts us at the bottom when you compare to our neighbors. We're encouraged by a lot of the strides that we've seen, but we really need to be realistic about the fact that there's a lot more to do. We know that our kids need more support, and we need to do more to make sure that they are living up to their full potential and they're living happy, healthy, and productive lives. One of the biggest areas that we saw improvement this year is the number of kids that are living in families that spend more than a third of their income on housing. This is called the high housing burden. There was actually a 22% drop from when you look at 2015 to 2010. So just under 400,000 kids are living in these high housing burden environments. We know that when those resources are going to housing, that means there are fewer resources for other things, where kids get less, perhaps food or health care. They have less access to preschool or books. Housing instability also can disrupt a child's support system. It can have a negative impact on their school performance, their mental health, and their behavior. We know that sometimes that instability also translates into lower reading and math skills. So again, it's one of those things where we need to look at what solutions are available, and that we know that access to affordable housing, decreasing that housing instability, reducing the number of school changes will really benefit all kids in the long run. One of the improvements we saw is that there are actually fewer Hoosier kids who are uninsured. We know that kids without insurance are less likely to have what we call a medical home, someone that they can go to when they're ill or they need care. They are more likely to have unmet medical needs, and there's a higher risk of critical needs or hospitalization. So again, we're talking about kids with insurance are more likely to receive that care when they're needed. They have fewer sick days. They have better class attendance and attention. Health insurance coverage also leads to lower mortality rates. Again, when we're looking at particularly low-income kids, we know that expanding coverage actually has a correlation to their high school and college graduation rates, which obviously is a big positive for the state and for that individual child and family. So the solution here is, again, access to affordable health care, which is critically important to their overall healthy development. In looking at the most recent data, which compares 2010 to 2014, we saw a 30% decline in the percentage of teens abusing and using drugs or alcohol. Again, the data tells us that teens are waiting until they're older to drink or use drugs, and this is a positive. Fewer teens had their first drink before the age of 13, and fewer teens had their first experience with marijuana before the age of 13. Fewer teens are being offered, sold, or given drugs on school property, and fewer teens report that someone gave them alcohol. So again, these are all positives and moving in the right direction. What we need to continue doing is having these conversations with our kids. The research tells us that the parents are highly influential in their kids' lives, despite what we may think as parents or what the kids may tell us. We know that we need to keep talking to them about the rules, possible outcomes, and their responsibilities. And as parents, we need to stick to the consequences and rules and values that our family establish. Our number one area that we need to really focus on and pay attention to is our number of teen and child deaths. That's based on the fact that there was an 11% increase from 2010 to 2015, which places Indiana in the bottom 15 states when you compare all the numbers across the country. This increase in the number of deaths was across the board in many categories, two of which really that we are highlighting are homicides and suicides. We did see a decline in the number of accidental deaths for kids ages 14 and younger. At the same time, there was an increase in that same definition of accidental deaths for children aged 15 to 24. Some of these incidents are preventable, and those are the ones we really want to focus on and talk in our community about what can we do. Number one in those is suicide. We know that this is a mental health issue. We know that there needs to be access to care, and there needs to be ongoing conversations. Secondarily is homicides. We need to talk about conflict resolution, community engagement, building relationships, and mentoring. High poverty areas is another area that we need to focus on. 13% of Hoosier kids live in areas where at least 1 in 3 residents live in poverty. Many times this is concentrated in urban areas. They're less likely to have access to high quality schools, less likely to graduate high school or college. There's a higher risk of teen pregnancy, and there's a greater risk for health problems such as low birth weight and food insecurity. We also, in these high poverty areas, there's also often more frequent exposure to violence. And exposure to violence can, but doesn't have to, predict future violent behavior. There's a greater chance of your child getting hurt, and there's a greater likelihood that those kids will become involved in the juvenile justice system. So again, all of these things beg the question of what's the solution? We know that there's a lot of great research out there that says that housing vouchers really are one of the keys to helping children out of poverty. We know that kids with vouchers have improved mental and physical health and overall well-being. We know that, in fact, it can lead to higher incomes in their mid-20s compared to kids who stayed in those high poverty neighborhoods and environments. Fourth grade reading, we know that 60% of our kids were not proficient. And as far as when you look at that, as well as 8th grade math, 61% were not considered proficient. So when we're talking about a lack of proficiency in reading, that means that verbal skills are lacking and that these kids are less likely to be academically engaged. When there is a proficiency in reading, they're more likely to graduate high school and attend college, and these students are also less likely to be unemployed. The reality is some kids can catch up, but most do not. So proficiency in those middle grades is strongly associated with meeting the benchmarks in future grades. So we really need to make sure we're focusing on these proficiency rates when they're young so that we can set them up for success in later years. So again, those solutions, some are on the home base. We can read to kids daily, make sure that they love reading, encourage that, enroll kids in high quality pre-K. And then some of it is more on the policy level, making sure that there is high quality pre-K available for all of our kids to set that baseline foundation in reading and math. Unfortunately, Indiana has not moved the needle on the number of 3- and 4-year-olds who are enrolled in high-quality pre-K programs. Kids in these programs make strides academically, emotionally, and socially that last for years to come. The effects are critical, particularly for low-income kids, where there is the greatest need for access, again, to the high-quality programs. 68% of eligible Hoosiers currently lack access to quality pre-K. In many situations, particularly in rural areas, it might not be an option. So the solution is to expand access and focus on it being affordable, accessible, and last but certainly not least, high quality.